So I'm a fellow from 2012, and I'm just going to tell you a little bit about my fellowship and the work I've been doing since I've come back. So I work for a children's charity called St Christopher's, and we provide both foster care and children's homes for looked after children. So looking at children's homes was really important to me. In this country, we've really moved away from children's homes being a preferred option for looked after children. So about 30 years ago, more than 30% of looked after children were living in children's homes, and today it's 9%, with the vast majority of children being in foster care who are looked after. And I'm not knocking foster care at all. For the vast majority of children, that is the better solution for them. But working with some kids who that's not an option or it's not a good solution, we're just really keen that we keep a children's home solution that works in this country. So for some of the children, it might be that they've entered care a lot later in life. It might be, so they're really just preparing for independence rather than looking for a new family. It might be that their specific needs don't mean that they can't be looked after in a foster home. Or it might be that they're a large sibling group, so again, they can't be looked after in a foster home and kept together. There is also quite a big difference in the cost of providing care in children's homes and foster care. So children's homes are many times more expensive than placing a child in foster care. So with local authorities having to cut their budgets every single year, it's another reason why children's homes are really getting squeezed. And what I wanted to do was look at children's homes in other countries and see, are there elements of that we could use to keep children's homes in this country, so that for those kids that need them, we've got a really good option that's useful. So the places that I went to were Norway, Sweden and Germany, and that was because they are places that we think of as providing good care for looked after children, and also some of the cultural differences are less extreme than in some of the more further afield countries. So I wasn't looking to go and take a model that I saw over there and bring it back exactly. It was really just looking at elements of practice that we could use. Some of the things I learnt when I was doing my fellowship and thinking about what would I do differently if I was going to do it now, was my initial approaches to people. I did tend to approach people I didn't know and write in English, which I think looking back was terribly rude and not very helpful and didn't get very good results. So I think if I was doing it again, I would have used some translation help at the beginning, both to sort of make those initial contacts, but also for some of the research that I was doing, because a lot of the sort of terminology is quite different. That was a bit of a struggle for me. I should have invested a bit earlier on, I think. Once I did have connections, it was really helpful, and I think, as people have sort of alluded to earlier, some of that, using those people will then say, oh, you need to talk to this person and you should go and visit there. Once you've got some of those links, it becomes a lot easier, and I think I probably would have used some of my links at home to do that too as well, looking back. But again, as people have said, using the Winston Churchill name is also really helpful. It kind of gives a real credence to what you're doing. So when I was out there, some of the things I found was it was very reassuring that the places I visited did seem to be providing good quality care to children, and a lot of the same things that we have here in terms of the aspirations that they were looking for looked after children. They also faced a lot of the same difficulties in terms of things like the challenges of proving outcomes and things like that. The stark differences for us were the number of children in children's homes. So in this country, 8 children in a children's home is loads. In some of the countries I visited, there were 100 or 150 children on one site, and that's something that we've moved really far away from, and maybe not quite ready for again yet. Also, the age ranges were very different. So in this country, we kind of feel there's something inherently scary and dangerous about placing a 7-year-old with a 16-year-old. But in countries I visited, that was quite common, and they could see some of the positive elements of that, so that the older children being able to be the good role model and being able to be the grown-up in the situation. Also, some real differences in staffing, both in terms of the number of staff. So it's quite common in children's homes in this country maybe having 12, 14, 18 staff in one children's home. So then children are actually trying to form attachments and have relationships with maybe 20, 25 key adults in their lives, when you're taking into account social workers and parents and all those things. And that's a lot for kids to have to do. Whereas in some of the countries we visited, there might be 2 or 3 people looking after the children, so huge difference. And the qualifications very different as well. I think that's something that we're looking at in this country, about trying to improve some of the qualifications that we expect from people in children's homes. One of the other things that was quite noticeable to me was the willingness to talk about loving children in other countries. We're still a little bit wary in the childcare sector in terms of we can say we care for the children we look after in our children's homes, but we're still not confident that we're allowed to say that we love them. And I think, again, thinking about attachments and relationships and how we do that kind of work, it's quite important that maybe that's something we develop in this country as well. When I came back, I worked with my colleagues at St Christopher's to work out about 20 different proposals, and some of the things we came up with were not really that feasible in this country. Some of them probably weren't very good ideas, but we got about 8 of them that we did into more detailed proposals, and actually went and spoke to the Department for Education about some of the things we were thinking of doing. And we've just heard about 2 weeks ago that we've been granted an innovation programme pilot. So we're going to run 2 children's homes this year looking at child sexual exploitation and providing like a solution within the community. So a children's home, and again that's come very directly from the work that I've done with Winston Churchill, so thank you very much.